The first case we're going to discuss today is a 61-year-old female who presents with multiple myeloma with a T416 translocation. This would indicate that there are some high-risk features based on the genetics of her disease. She's treated with a combination of lenalidomide, bortezomib and dexamethasone and attains a partial remission. Subsequently, she goes on to autologous stem cell transplant and lenalidomide maintenance, giving her high-risk features. About 18 months post-transplantation, this relatively young woman comes back with evidence of biochemical progression, a rising monoclonal protein, despite therapy with lenalidomide. At this stage, the patient remains relatively asymptomatic with a biochemical relapse only and no change in her blood counts. This young woman received lenalidomide, bortezomib and dexamethasone therapy as her initial treatment. This has become essentially the gold standard of care in the United States. Recent phase 3 trials have shown that this combination is superior to the use of lenalidomide and dexamethasone alone, at least with respect to progression-free survival and response rate. This patient obtained a partial remission and went on to receive an autologous stem cell transplant. Recent studies, particularly from France, have continued to demonstrate the value of transplant even in the era of new drugs, such as the ones that this patient received. Specifically, their trial, which was in over 600 patients, demonstrated much better prolonged survival or prolonged progression-free survival in patients who received a transplant when compared to those patients who just maintained the same therapy over about a 9-month period.